Terminal illnesses are an unfortunate presence in many people's lives. Whether it's a friend, a relative, or yourself that finds himself wasting away in a hospital bed, the misery and shame remains. Cancer, heart disease, and in the last year, COVID, are all conditions that can give a dire prognosis. But what if there were another option besides waiting for death to sneak up on you? What if you could look death in the eye with dignity? This is what House Bill 47 aims to give terminally ill patients in New Mexico. Also known as the End-of-Life Options Act, this bill allows patients with at most 6 months to live to request a prescription for medication that allows a peaceful death. Other safeguards for this bill include: the patient must ask the provider to prescribe the medication that will allow them to choose a peaceful death. The doctor must then conduct an appropriate examination, and the patient must be deemed capable of making a mentally sound decision. Then, the provider must explain all the risks and the alternatives to choosing a peaceful death. After the doctor prescribes the medication, there's a 48-hour waiting period before it can be dispensed. Then, the patient must self-administer the medication. These policies ensure that the patient gives full, voluntary, informed consent to the procedure. The main benefit to this bill is that it eases suffering for the terminally ill patients, and not just those who choose a peaceful death. 1/3 of patients who request the medication never use it. Just knowing it's available brings them peace of mind. One major objection to this bill is that doctors may face a moral dilemma when asked to provide medication for a peaceful death. Luckily, the process is entirely voluntary, and no physician or healthcare provider is obligated to participate. If a doctor wishes to opt out, the patient will be provided with another physician to prescribe the medication and aid with the process. Religious groups have made objections to this bill based on their views of the sanctity of life and the morality of any kind of suicide. However, House Bill 47 was signed into action by the New Mexico governor in April of 2021 and will go into effect in June of 2021, leaving 41 states without any provisions for those who wish to face death with dignity. The organization, titled Death with Dignity, advocates for more policies and better policies for those who wish to choose to die with dignity. Their Action Center gives several options for those who wish to get involved in this issue. These include writing to or for a local newspaper, spreading the word to your community through film screenings, and getting involved with your local legislation. Staying informed is an important part of advocating for this cause, so keeping up to date on your state's legislature regarding this issue is a good way to get involved. One way to maximize the consequences of your involvement in this issue is to start a fundraiser for the Death with Dignity nonprofit, or donate directly to their cause. This allows them to continue their own advocacy work and lobby legislators throughout the country to get policies in some of the 41 states that have none so far.